Today we will be presenting on the nutrition topic, talking about Preventing Foodborne Illnesses by Chelsea Croak, Brea, Hopgood, Kendall, Jukka, and Zahradka. First of all, we will be talking about what is a foodborne illness. By definition, foodborne illness is a preventable entity caused by a variety of agents that a person ingests via a contaminated food or beverage. Now we will talk about the effects it has on the population of the U.S. Nearly 76 million of people get foodborne illnesses each year, and of those 76 million, 325,000 are hospitalized, and approximately 5,200 die from these illnesses. This is according to the National Hospital Discharge Survey and the Foodborne Disease Active Surveillance Network. But there seems to be that there may be report of people that may be having these foodborne illnesses. Nearly half of the foodborne illnesses come from leafy green vegetables in the United States. Some other things that are commonly have foodborne pathogens include milk, poultry, raw seafood like shellfish and oysters, and contaminated water. Some other populations that may be at risk are areas of the world with less standardization for foods and water supply. These may include things like places that have no FDA kind of situation like we would have in the United States. Ecosystem and climate also play a large role in the pathogens that are present in these areas, since pathogens grow more in warm and moist areas. This does not mean that the U.S. is safe, however, because people travel to different places of the world where these pathogens are, and they can come back to the U.S. The FDA provides good standards for our food to be met in order to be served and purchased. Improvements can be made to the system because it isn't perfect, however. Some of the common types are hepatitis A, E. coli, and salmonella.
There are several agencies used to help regulate food and drugs that are bought by consumers. The main one is the Food and Drug Administration, which regulates food products commercially and takes action to correct issues or potential issues when food products are mislabeled, present a health risk form contamination, or have caused an outbreak of illness. The FDA often works in correlation with the CDC, the Center for Disease Control, to regulate food products and disease outbreaks. Also, the USDA, or U.S. Department of Agriculture, is the department that regulates beef, poultry, and processed egg products. Additionally, the foodsafety.gov is an educational tool for food safety and recall information for consumers as well as healthcare professionals. The FDA Coordinated Outbreak Response and Evaluation is a tool that you can use as a healthcare provider to gain information about current investigation, recent outbreaks and recalls, as well as information to report an injury or illness from a food product. You can also direct your clients to this website to help them stay updated on outbreaks in their area or outbreaks across the U.S. Additionally, there are some tips that you can give your clients when they're purchasing their food at grocery stores or wherever they might purchase their food from, including vending machines. So there's 7 tools that you can look at to assess the food before you purchase it. One that you can use is checking for cleanliness. And so if you're buying from a retailer you're looking to buy from a retailer who follows proper food handling practices to help assure that food is safe. Additionally, they need to keep their food separated when purchasing. That includes raw meat, poultry, and seafood from other foods in the shopping cart and grocery bags. A good tip is to place these food in plastic bags to prevent cross-contamination. Number 3, they should inspect cans and jars. They should not buy food in cans that are bulging or dented, or in jars that are cracked or have loose bulging lids. A bulging lid or jar may mean that the food is underprocessed or could be contaminated. And a dent in a can, especially if it's a dent at a seam in the can, may cause an opening in the seam, which could cause contamination. And a loose lid means that the vacuum seal has been lost and the product may be contaminated. Number 4 is inspecting frozen food packaging. So they should not buy frozen food if the package is damaged. Packages should not be opened, torn, or crushed on the edges, Also, they should avoid food packages that are above the frost line in the store's freezer. Number 5 is selecting frozen food and perishables last. So when they're shopping, they should get all of their dry products first and then end at the frozen food and perishables section. Number 6 is choosing fresh eggs carefully. Before putting the eggs in their cart, they should open the carton to make sure that the eggs are clean and none of them are cracked. And they should only buy refrigerated eggs. Number 7 is to be mindful of time and temperature. Also, you can give your clients some prevention techniques. So in addition to purchasing products, they also need to be aware of how to store and prepare their food properly. And so they should defrost frozen items that are in the refrigerator, or defrost frozen items in the refrigerator instead of leaving them out in the open on the counter or something like that. They also need to use appropriate cooking thermometers that are used for the specific meat they are planning to prepare, as well as the eggs. The refrigeration should occur at 40 degrees Fahrenheit. Also, they should keep their leftovers no more than 3 to 5 days. If they do, they should throw them out. Additionally, they should wash raw fruits and vegetables. And when they are unsure of the expiration date, if it's worn off a product or if there is not one on the product, they should throw it out using the when in doubt, throw it out rule.
Some signs and symptoms of foodborne illness include diarrhea, nausea, vomiting, abdominal pain, fever, and dehydration. Although not everyone reacts the same to foodborne illness because it depends on your age, your level of health, and the amount of exposure you had to the pathogen. Those at high risk are older adults, infants, and young children, and then also people with chronic disease, because these individuals have a less reactive or underdeveloped immune system. Some causes of foodborne illness are from ingesting food or water that is contaminated from bacteria, viruses, parasites, and/or chemicals. Some bacteria that can cause foodborne illness include Salmonella, E. coli, Listeria monocytogenes, and Clostridium botulinum. And these can come from raw or undercooked meat, poultry, dairy, and seafood. Or it can come from raw or undercooked hamburger meat, unpasteurized milk and fruit juices, and fresh produce can all have E. coli on them. Ready-to-eat deli meats or hot dogs could have Listeria monocytogenes bacteria in them, and canned foods and smoked or salted fish can have Clostridium botulinum in them. A few viruses that you could get from foodborne illness could be from food that was prepared by someone with a virus, by them not washing their hands, or somehow getting like their saliva in there by sneezing or something in the food, and then the patient ingesting that virus from the food. Shellfish or produce that is cleaned with contaminated water where the water has the virus in it. You can get foodborne illness from parasites, which come from raw or undercooked pork or wild game, which would have Trichinella spiralis in it. Or you can have foodborne illness from chemicals, which include fruits and vegetables that have a high quantity of pesticides on them, and if you didn't wash off those pesticides, you could get it from those chemicals.
So two of the most common types of foodborne illnesses that I wanted to focus on were E. coli and Salmonella. So the treatment of Salmonella is pretty simple. You just need a lot of fluid and electrolyte replacement because you have a lot of fluid and electrolyte loss through vomiting and diarrhea. But the only time you would ever use antibiotics for the treatments of Salmonella is if you have Salmonella infection in your bloodstream. The next one I want to talk about is the treatment of E. coli. E. coli is the same treatment because you pretty much have the same symptoms unless you develop HUS, which is hemolytic uremic syndrome. This happens when you are given antibiotics, because you're not supposed to be given antibiotics with E. coli because it will destroy your normal flora. So treatment for HUS is renal replacement, fluid replacement, blood transfusions, and high watch on electrolytes and nutrition, along with many other things, because HUS is a dangerous development of E. coli. Then healthcare implications. So in the health field, us as nurses can check food temperature so that our patients not only get the type of food they deserve, but that their food can stay safe. So covering your food ensures that a possible airborne bacteria can't contaminate sealed or covered foods, keeping the possibility of transmitting a virus through food is limited. Having a clean plate and clean utensils can keep a patient safe in a lot of different ways, because dirty plates means bacteria is eating the food left on the plate, increasing the chance of getting food poisoning. This also prevents cross-contamination if the food previously on the plate was raw or something the patient is allergic to. Rubbery food is undercooked food, which means that it shouldn't be used or given to our patients, along with pink or bloody meats. Washing your hands and wearing gloves is an important step for food handling because it decreases the chances of multiple pathogens spreading through food. So if you would like to, even though you have to, this is our feedback tool, and we would appreciate if you answered all these questions. And then these are our references. Thank you for watching our video.